Hi everyone, Dr. Pope here. In this video PowerPoint, I'm going to be going over some of the basics of chest X-ray interpretation. The most common types of X-rays that you're going to see, chest X-rays, are the PA lateral, and the anterior posterior. The difference between the PA and the AP is in the direction that the X-rays are traveling. So in the PA, it's posterior to anterior, and in the AP, it's anterior to posterior. Most of the time in primary care, you would be ordering the PA. We just get a much better view from the PA. And when we do the anterior to posterior, it becomes a little bit more distorted and almost magnifies some of the landmarks. And we'll look at that in a minute. So just like the 12-lead EKG, the chest X-ray is another one of the most common diagnostic tests. We use it to evaluate symptoms such as a patient with a chronic cough, or to evaluate a physical finding such as hypoxia. We can screen for a pneumothorax. And in the hospital setting, a lot of times we're looking for the placement of lines and tubes. So this slide shows you the difference between the PA and the AP view. And you can see on the AP view on the right that, the heart looks very enlarged. It looks like a lot of, gray markings here, not as clear. Just can't visualize everything as well as in the PA. So unless that patient is bedridden, you're going to order a PA, not an AP view. So when we analyze our chest X-ray, we kind of want to go through these steps each time so we don't miss anything. We follow this A, B, C, D, E, F process. So we start with A, which is our airway, and we want to check and make sure that our trachea is midline. Then we move on to bones, and we want to make sure that the patient is straight, that we should see the left and right clavicle, and we should also see the ribs coming around. Then from there we move on to the cardiac silhouette and the mediastinum. Make sure nothing is enlarged, that the patient does not have an enlarged heart. Then we check the diaphragm, and we want to look for the gastric bubble. The gastric bubble should be on the patient's left side, and a little pearl is if you happen to see it on the right, there's a good chance you might have your X-ray backwards. So take a look and maybe flip it around. Then we want to check for effusions, and I have an X-ray in here that I'll show you. And basically, when you're looking at your lungs, you should see very clear bases, and we'll look at that in the next slide. And then after we check for effusions, then we're going to check all over the lung fields. We leave the lungs at the very end just so we don't miss any of these other important features of the chest X-ray. And finally, if you're hospitalized, your patient's hospitalized, you may be looking at lines or endotracheal tubes. But even in the primary care setting, you will be able to see things like pacemakers or clips from previous surgeries. So here's a chest X-ray, and we'll kind of go through this and take a look at everything. So we'll start with our A, which is our airway, and you can see right here our trachea is nice and midline. Then we'll move on and check out our bones. Here we have our left and right clavicles. The patient looks like they're pretty straight, and we can see our ribs coming around nice and distinctly. Then we move on to our cardiac silhouette, okay, right here. And this patient does not look like they have an enlarged heart, and I'll tell you, we'll look at someone who does in the upcoming slide. We can see our diaphragm, okay, higher on the right, and then our gastric bubble here. And again, if this gastric bubble was over here, we might have to flip our chest X-ray around. Then E, we're going to look for effusions. So effusions would cause blunting down here. Instead of this nice base here, this nice edge to it, you would see a lot of blunting. So I'll show you a chest X-ray of someone with pleural effusions. And then finally, we'll check out our lung fields all over. Look for any masses, check for any consolidation. And so now let's look at a couple examples. So this is a patient who has tracheal deviation. You see it where those arrows are. This is due to unequal thoracic pressure. This is a tension pneumothorax, could be caused from a pulmonary mass, a malignancy, several different causes. Here we have a patient, if you notice where the circle is, that has some old rib fractures. You can see them right there as opposed to on the other side. It's just a distinct finding. Here's someone who has cardiomegaly. Remember what I told you, you would only accurately diagnose this in a PA film. So if you notice that their cardiac silhouette is greater than 50% of the cardiothoracic ratio. So if this was one of your findings, then you would want to follow up this patient with an echo, unless they were already diagnosed with cardiomegaly or heart failure or something like that. Here we have a patient with a pneumothorax. This can be subtle and difficult to spot, but if you look, the arrows show you actually where the lung has collapsed in. Less than 2 centimeters is considered small, greater than 2 centimeters is considered large, and it can either be a primary or secondary pneumothorax. A primary occurs without a known cause and in someone without a known history of lung disease, and a secondary occurs in the presence of known lung disease. Here we have a patient who has pneumonia, very distinct lobar consolidation, and a lot of times this will correlate with a clinical history, fever, cough. This is someone who has pulmonary congestion, someone who is in CHF. You see how huge that cardiac silhouette is. You see diffuse alveolar edema and big increase in the heart size. And this patient would have clinical correlation, probably may have some lower extremity edema, severe shortness of breath. Here's somebody with a pulmonary mass. And here we have pleural effusions. And like I told you, this is somebody who has a left-sided pleural effusion. And you see here all this blunting, okay? As opposed to here where you have a nice crisp edge to the base of the lung field. So this was just a basic overview of chest X-ray interpretation. I've put some other videos into this module that go into a little more detail. And I've also put some information about abdominal chest X-rays as well.